Did you know that PCOD and PCOS are not the same thing? I know we have been confused about this a lot because as soon as we see there is a menstruation related disorder, then we kind of use both of this term PCOS and PCOD interchangeably as if they mean the same thing. But to be honest, it is not. There are huge difference between the two. Even sometimes you might have menstrual problems which have nothing to do with PCOD or PCOS. Hi guys, my name is Saish Prabhu and today we are going to talk about PCOD and PCOS, mainly the general difference between the two. And in further videos, we are going to go in detail about each of them. Welcome to Becoming Wiser, and today we are going to talk about the major difference between PCOD and PCOS. Before we begin with each of these terms, let us first understand what is polycystic ovaria. So, polycystic ovary is something where you have multiple cysts that are growing inside the ovary. So, how that happens in a very simple terms is that you have ovary, then there is ovulation happening inside it. So, the ovulation is a process that gives rise to the egg. The egg then goes into the uterus, gets implanted. You have sperm coming in, fertilize it, you have a baby. Or if the sperm never fertilizes it, then you have periods, the blood is washed away, and the whole cycle repeats itself. So, this is a process where the ovaries are producing an egg, and the egg is matured once so that it can give rise to a new offspring. But what if there is not enough energy in your body to produce that matured egg, and the egg kind of dies, it doesn't grow, and it turns into an empty cavity. So it's kind of an empty cavity that leads to the cyst. If imagine there are multiple of these eggs that are produced, but they are not ripe and they are not given out through ovulation, they don't reach out of the ovary, and then they stay there and turn into a cyst. So this is called polycystic ovary. So when you have a polycystic ovary, you can imagine if there is a natural process that is happening, a very well planned ovary that is giving rise to an egg, and the egg is given out of the ovary, then it will have a proper balance of hormones as well. But if you don't have this, then there will be imbalance in the hormones itself. So a polycystic ovary can give rise to a lot of imbalances in the body. Now let us come to the DNS part. So that D represents disorder. So polycystic ovarian disorder. So disorder means there is an imbalance in a particular system of that particular organ or that reproductive system. So now there is a disorder in that particular system. So there is a malfunction happening only in that region. So it can give rise to multiple symptoms like you can have irregular periods, you can have, let's say, some minor imbalances in the hormones, you can have periods that are longer, you might have periods that are coming a few weeks late. So there can be multiple, you can have minor weight gain also, you can have certain mood swings also. There are multiple things that can happen during that process, but it is mainly related to your lifestyle. So in PCOD, what actually happens is you are experiencing certain changes in your body which are related to your lifestyle. Sometimes it is related to stress, sometimes it is related to irregular eating, sometimes it is related to just being lazy, not doing enough physical work, and many times it can be also that you don't follow proper lifestyle, like you don't eat on time, you are not following the patterns of the nature, like you are not taking care of your body during winter or summer. All those things can lead to like imbalance, so these are the reason you start developing this cyst and imbalance, minor imbalance in the hormone. So it's more of a lifestyle organ related problem. While if we go into the S part, that is the polycystic ovarian syndrome, now that syndrome, that word itself represents that it is not a particular imbalance in the organ system. It is a whole imbalance in the body. So syndrome is a general term that we use for a certain symptoms that are occurring together club together. In that particular syndrome, you also might have polycystic ovaries also. It might not be absolute. You might not have ovaries that are having cysts. You might have one or two cysts and they are there, but the main problem that happens is your whole body's hormones and the system is kind of having a huge imbalance. And this is a major problem. This is not just simply a lifestyle problem, it's a huge imbalance in your hormones. So, what it leads to, it can cause severe problems in your body. It's it can be caused due to lifestyle changes, but it can lead to major consequences like you can become overweight in the sense you can become obese, like as if you are doing overeating. You can have certain symptoms like you feel chubby face, more fat growing in your abdominal regions. You can sometimes have thyroidal imbalance also. You can have insulin resistance also. You can develop type 2 diabetes. So a lot of people after certain age, when their body's hormone starts becoming imbalanced, they start developing type 2 diabetes. So diabetes is not the problem you should be targeting in that cases, especially for women who are having an onset of irregularity in their period. They stop period for months. They are not having any period, or their periods are very long. Instead of 4 day, 5 day cycle, they go to even week or two. So sometimes you get lot of excessive bleeding also. So there are a lot of things that are clubbed together and it can lead to a systemic disturbance in your body. So that is a syndrome, polycystic ovarian syndrome. We will talk more in detail about each of them when we talk about them according to our traditional Chinese medicine concepts, because it is very difficult to understand them if you go just with the hormonal theory, because you can see that the hormone imbalance can be caused even if you skip a period, even if you take certain pills like I pill to prevent a pregnancy. You can have these things happening even if you are on thyroid medication. So we have to think about it in a major problem, like how it is affected throughout the body, what is causing this kind of irregularities in the body. So in this video I'm just trying to explain that the two disorders, one is disorder, another is syndrome, are not the same. They are quite different. One is a disorder which is a very systemic, based on the reproductive system, that is ovaries or uterus that is involved, while the other is a major system imbalance that is happening throughout the body, including the reproductive organ. You have to really, really take care of your body, my friend, because this starts with the lifestyle changes, this starts with our irregular habits, and slowly, slowly, with medication, it becomes worse and worse and worse. So, it is earlier you diagnose it, it is better for you to actually have a proper system of treatment protocol. So stay tuned if you want to understand what is the difference between PCOD and PCOS in more detail. And I will make another video for this, and do subscribe to the channel. And if you have PCOD or PCOS, do let us know in the comment section so that in any way possible we could help you in treating or in at least prevention of it, or preventing the worsening of the condition as age progresses. Thank you so much. Jai Hind.